First, I'd like to welcome all of our attendees to the Windshire Group's Ask the Expert series, How to Leverage the Digital Revolution in Early Stage Companies, with our special guest from the Court Square Group. My name is Jen Bardsley, and I'll be serving as your moderator for today's webinar. I currently serve as the account manager slash operations manager for the Windshire Group. So I would like to note that the views expressed in this webinar are those of the panelists. It's for informational purposes only. It's not intended as legal or regulatory advice. And to introduce our panelists, we have Dr. James Blackwell, who's president and principal consultant for the Windshire Group, which was founded in 2011. The Windshire Group accelerates development and manufacturing for commercializing therapies and provides quality expertise. Dr. Blackwell has been a leading industry consultant for more than 15 years. And we also have Keith Parent, who is a founder and CEO of Court Square Group. He leads the company and the vision for using IT as a strategic enabler for life science companies from preclinical all the way to manufacturing.
The webinar today really is the marriage of the user requirements for small companies and the marriage of that and the IT structure and organization of the company. It's a very important factor. And why is this important? This is very important for small companies because it's important for them to improve their operational efficiency. People spend less time looking for stuff, and it speeds up your business processes. And you want to facilitate decision making. You want to be able to access the most current and correct information, and it increases organizational value. A disorganized information with their information all over the place can kill a deal. We've seen that happen. Due diligence and data rooms need to be well designed and populated with good information to facilitate deal making. So that can be very important to small companies. And you're creating very valuable information. And this will be important later for your regulatory filings and for compliance needs, and for your technical people who want to access and understand the history in terms of what's happening within the organization. So this helps you avoid compliance issues later, patient privacy laws, health authority issues, or potentially even SEC violations. And also it creates a more satisfied workforce. Studies have shown people are happier when they're dealing with environments that are well organized and they're able to work efficiently. Nobody wants to be in a cumbersome, inefficient, time-wasting environment.
How can we integrate information and data from different sources so that it is easy to find and compliant to future regulatory submissions?
So I think that the major part about this particular question that we put together was just identifying where you are in the process and where the data is coming from and how it's tying together. So this particular framework just looks at all the way from discovery and preclinical through clinical, through data management, regulatory, into manufacturing, all the systems. It goes right along with what we showed earlier in a manufacturing environment where you had all the different levels. Well, in every environment, there's a cycle of how data gets transferred between different systems. So our goal is to figure out, where does that data come from? How do we group it together, and what systems are going to be used to gather that data? So the first thing you really need to look at is you got to solve your problem. So again, each department may find an application specific to that problem. If I'm in clinical operations and I need to get trial master file information, I need to get a TMF. I need to pull that stuff in, and I need to look at how that's tied together to that particular trial. However, when I go to regulatory and I'm going to do a submission to a regulatory authority, I now need to put that into an eCDD format to go to that particular regulatory authority. So I may start to work with a RIM system that may have multiple applications that help me to do that submission. How does data flow from one to another? Can I use drag and drop? Can I maintain links between documents? Those are all simple things that you have to think about when you do stuff. If I'm in the clinical supply chain and I've got a clinical supplier, how am I taking the data that comes from that supplier and incorporating that into my clinical trial management system? So those are all areas that you have to at least scope it out and understand how it all works together when you're doing this work. But if you do that, you can actually stay regulatory compliant, and that's the important part.
Thanks, Keith. My wife was a corporate information specialist, and she had a saying, what's the use of having information if you can't find it? And one of the biggest problems we see is with all this information in different databases and different systems of record, it can be very challenging to find the information you need. So we talked about building some of the hierarchy and business systems that can make that data and information visible to end users, but also in terms of querying it. What I can say is that we have some proprietary solutions that are very powerful that can help companies in terms of finding the information that they need.
Well, and I think, James, also to that point, I think if you look at this continuum, one of the things that people think about is when you're in a discovery phase, you want to be really collaborative and you want to share things across different departments and you want to work with stuff. But when you start to get beyond that and you start to get into clinical, you got to start looking at how do we segment that data out and how do we make sure we have control over that data from a perspective of any kind of auditing and things like that. So once we get past that, we did a project with a company that they wanted to maintain that sense of the scientists being able to be very collaborative out there, but they also wanted to know how can we then look at that single source of truth so that as we're tracking that document all along the way, we know where it came from. In their case, it happened to be when finance put a project number on that particular project. So that was that pivot point that we used to say, hey, it's going from this freewheeling discovery type phase into an area now that we're gonna have to track it a little bit more closely. So it's simple things like that, that you get the corporate buy-in for that, and everybody understands why they can do certain things in different areas. And whenever you're dealing with a QMS system, most quality departments don't really want anything in their QMS other than their particular documents and what they need to have for that. So it's understanding the mentality and the functionality that you're dealing with for each system that you're trying to put out there as well.
Absolutely, Keith. It's understanding those end users and their requirements. As we all know, scientists don't want to be governed by rules. So sometimes they would get scared by the word governance here. But actually, if brought in properly and structured properly, as you mentioned, it actually enables their job because they don't want to be frustrated looking for the information they need. They don't want to lose the information they need. They sure as heck don't want to delete it accidentally, right? So these things can enable their science and have them focusing on what they do best, and increase, again, the overall operational efficiency and effectiveness of the organization.
Absolutely.